So are you satisfied with the measures that the government has taken to curb the spread of coronavirus? Are you satisfied? Do you feel like it will go a long way in helping us deal with this particular virus? That is what we are asking you this particular morning. Remember, you can share your thoughts with us at KBC Channel 1. The hashtag is NewsCheck. But for now, allow me bring my guest into the conversation. This morning, I'm having a sit down with Mr. Hitan Majevdia. He's the Health CEC of Nairobi County. Thank you so much, sir, for creating time for us at this particular time. We are trying as much as possible to maintain social distance, as you can see. But, you know, your general perspective on, we're asking our viewers this morning whether they are content with what the government has been able to do so far since this spread began in the entire globe. What would you, describe the steps that they've taken to be like? Are they effective? Are they something that, is this a step in the right direction?
I think first of all, I must commend the Kenyans. They are so well informed. They know what is to be done, but they're not doing it. Anybody you ask is so much well aware of what is to be done, but on the ground it's not being done. So that is the sad part. I want to tell everybody, listen to what the government tells you. This situation may escalate to a situation like Italy. So please listen to what, when Mutahi Kagwe speaks, he has a whole team of professionals behind him who is guiding him. You have seen the bold steps he's taking. Do you think he likes them? He doesn't like them. But we have to, we are forcefully doing it because we want to save the Kenyan. So please listen to what advice you are being given. This advice is given after a lot of research, consultations with other governments, other NGOs like WHO, the world bodies. Before a decision is made, there is so much work done behind. So please, when you are told keep a distance, wash your hands, it's something very, very important. Let's not come to a situation like Italy. Italy is in a bad state as we are talking. Every day, 700 people on an average are dying. We don't want even 7 people in Kenya to die. Not even one.
Not even one.
Not even
one life is too much if we lose it.
So my advice to Kenyans is please listen. Please listen and do what you are told. If you are told stay away, stay away. Let's not come to a situation of a lockdown. That is going to be the last option, which His Excellency the President will direct any time if it escalates. So it is us to act, not the government. It's the public who is supposed to act so that we control this enemy. This enemy is bigger than the Third World War. It's bigger than the Third World War. Third World War will be fought with bullets and guns and bombs. This is a silent killer. It's killing people all over the world. So let's be careful and we be prepared for it.
Okay. Looking at, how the trend has been, especially locally in our country, we began by reporting just one case, but we've seen the trend rising each and every day. Today we do not know what to expect. What does this, tell us?
This tells us that we are all careless. This thing cannot escalate if you self-isolate. If you know that you have traveled or if you have been washing your hands, this thing will kill itself. It's self-limiting. The viruses are self-limiting. They don't have a long lifespan. So if you know that you have traveled, go and self-quarantine. If you start roaming around the city or your village, you're actually contaminating other people. So it is our own creation. So that is why when we are being told to wash our hands, sanitize, listen, please listen.
And talking about listening, even in as much as it is a matter of life and death, we've had cases of people defying some of these guidelines. And this is what the Health CS Cabinet Secretary Mutahi Kagwe had to say with regards to what he says is indiscipline or failure by Kenyans to listen and follow some of these guidelines. Let's listen in.
We have said before that the kids were not sent home on holiday. The kids were sent home for protection. And let me just say this, for clarity. Let me just say this. We are suffering from cases of indiscipline. And Kenyans are exhibiting a very indisciplined behavior. And this is going to cost us. When we tell people, keep your kids safe, we don't mean you keep your kids safe by bringing somebody in who, for all you know, is coronavirus positive. We are telling you to keep your kids home with you, at home, not exposing them to the disease. That's why they are home in the first place. You know, so, Steve, you need to tell them. You are the one in the media. Tell them. It's a grievous mistake for us to give you your child because we don't want the child exposed, and then you go exposing the child at home. And then after that, afterwards, you call us and say, Serikali's idea. It doesn't work. This is one time when you idea, the government owns idea, because the
Health CS, just talking about, in as much as the government is providing information on what you need to do to prevent the spread of this virus, there's still a lot that needs to be done, if I may say so. Schools have closed, children are at home, but if you go to the residential areas and see what is happening, it's like it's business as usual. You'd see children just playing outside, you'd see just people interacting as usual, saying hi and greeting each other like there's nothing wrong. Do you think that people understand the magnitude of this problem? Has that information been provided just to see how big of an issue this is?
You see, this is the problem I told you in the beginning. Kenyans are very well exposed. They know everything, but implementing is a problem. Mm-hmm. We are so ignorant when it comes to implementing. Until the last day, when it spreads is when everybody will start implementing. This is what I'm urging everybody. Do it today. Why wait? You saw what he said just now, Mutai Kagwe. We should wait, do ourselves before the government comes to help you. So if you know your neighbor has traveled, or you have traveled, or your family member, you forcefully isolate that person because you don't know what he's carrying. So we must all work together. We have to fight together. Mm-hmm. So
all right.
Unless we do it,
nobody else will.
You know, even if the government comes in, it will come in if you're already infected. The damage is done. Why do you even go for that damage? Mm-hmm. Do it now.
But for some who have raised concern concerning the realistic nature of implementing some of these directives in our local context as Kenya, for example, staying at home, for example, washing your hands using soap and water. We've had cases of some residential areas that are still having a challenge with access to clean water. Some live on the meal that I'm having right now. I don't know what I will have in the next meal. So telling me to stay at home, is it realistic? Do you think it could be coming from a point of, yes, we want to obey these directives, but looking at our local situations and our circumstances, we can't? Not necessarily disobeying, but it's because they can't. What do you think?
Okay, in terms of water, the short-term measure we have done from the last 1 week, we have provided hand washing stations. If you go to the suburbs, yesterday also we had a partner, one of the NGOs, CRF, who gave us 100. So all over, and some corporates also have come up. So that is a short-term solution. Mm-hmm. We have talked to Nairobi Water to ensure at least there is running water, even if it is at a slow pressure, at least there is water to wash hands. So I think the water problem will be not solved 100%, but at least there will be water for washing your hands. Mm-hmm. And when it comes to implementation, look after your children, because you know your kids could be clean, but you don't know your neighbor. Maybe he has touched somebody else. So you see, that's how it spread. We do it, the kids could do it ignorantly, but it can be devastating. So we have to also control our children. Mm-hmm. Workers at home, you know, if you have a maid or a driver, well, yes, he is clean when he comes, but what has he done outside? Mm-hmm. Or what has he or she? Or when there is a delivery of milk or some vegetables, you see, those are precautions we must all take.
All right.
Or a driver, well, yes, he is clean when he comes, but what has he done outside? Mm-hmm. Or what has he or she? Or when there is a delivery of milk or some vegetables, you see, those are precautions we must all take.
All right. As the health CEC of Nairobi County, Nairobi being one of the counties that have since reported cases, among the 4 counties that have cases of COVID-19 in Kenya, since the first case was reported, probably take us through some of those measures. You've talked about a few that you've done so far, but tell us more about what are some of the measures that as Nairobi County really put in place as efforts to prevent the spread of this virus, and how is that going about?
Okay, the biggest thing we have done, and which has actually worked, is education and sensitization. That's why I told you everybody knows what is COVID, how to prevent it. They know. Ask anybody, pick anybody from the street, they know. But is that person implementing? They're not. So it means our project of education and sensitization has worked. We've actually gone to schools, to hotels, to restaurants, to large corporates, parastatals. You know, yesterday we were at NIS. We got over 2,000 youth whom we educated. So it's working very well. The education side, sensitization side is working very well. The only problem we have is implementation.
So what is missing? What is the missing link? Because the ultimate goal is to ensure that that information actually provides positive results. So if it is not providing positive results, would you term that as success?
Personally, I think it's ignorance of the person, or he's just taking it easy, lightly. You know, they think, they think it's just like a malaria; it will come and go. Or, you know, it's just ignorance, and that is, it's very dangerous.
What do you think needs to be done to create that seriousness?
You know, I
for
think
people to wake up and see the magnitude of this
spread
of coronavirus.
Kenyans will need some force to do it, which the government doesn't want to do. But if we have to, we'll have to do it. But I'm still urging people, please, please, please listen. Listen to the advice we are giving you. And the advice is all over. I don't need to repeat. It comes on TV, on radio, in newspapers. Our people are on the ground. So listen to that advice and implement. If you implement, I'm telling you, this will be a miracle. If we don't, we'll go worse. Yesterday, 2 countries, South Africa, lockdown. India, lockdown. 21 days. Do you know the impact on the economy? But it is better to do that than to have the impact of deaths like Italy. Okay? So even us, we are just watching. And maybe if situation is out of control and people don't listen, the government might have to take an action.
All right. Let's talk about, I hope it will not get to that
point. We are praying
too.
that, and that is why we are insisting on people to obey what we tell them.
All right. Talk to us about the nature of this virus, because yes, in as much as information is out there, it is still on such platforms that we can use to continue educating masses about it. From what you understand about the nature of this virus, and from what you understand about our culture and our lifestyle as Kenyans, how we live and how we do our things, how we socialize, the places we go, what are the things that put us at risk of contracting this virus? Okay,
Kenyans are very social people. That is another challenge we face.
It's a good thing, though.
It's a good thing. It's a very good thing. You see, I want to see myself the unity we had when we had the bomb blast, when we had the attack at the Westgate Mall. If we can unite like that and fight the way we fought the terrorists, let's all fight this. This is worse than a terrorist. Okay? So if we can all unite and be patriotic and we want to serve this country and our children, we will do ABCD, wash our hands, maintain social distance, all these things, which we are telling you. Just listen to that. It's easy, very easy, but it's also very hard, because our culture, African culture, when you meet, you hug, you clap, all those things, But there comes a time you have to choose, and this is the time we have to choose. Do we want to have a catastrophic effect of this virus on Kenya, or do you want a Kenya that will see even our other hundreds of generations?
So that's a question we need to ask ourselves.
Yes.
And I think the second response is what many people want.
Yes.
What is happening globally is, when this outbreak was first reported, China was all eyes were on China. Like it was really spreading fast, and deaths were increasing by the hour. Right now, Italy is being termed as the new epicenter.
Yes.
China, we receive news from China, but not as much as we used to. What has caused this trend? What has worked for China that probably we could, borrow as lessons going forward?
Yes, I was going to talk about China. What China has done, I'm telling you, is excellent. And the people of China cooperated with the government. Imagine locking down millions of people in their homes. Millions, like just to Wuhan, that city, that area was 60 million. Then they expanded. Almost 800 million people were not able to get out of their homes in one single time. We are just
this is way above our population.
We are just 40 million. We are just maybe one province of China. Why can't we do it? China has done it, and let me tell you, congratulations to them and the people of China. What they've done is just out of this world. Controlling 800 million. We can't control 8 people here. They've controlled 800 million people there. Excellent, and it's commendable, and you've seen how they've controlled it. And that is what we are telling our people here, the same thing. Let's control it. This thing is controllable if we all work together. It's not one person. You can't start saying, Sarkali, Sarkali, Sarkali. What have you done? You should start it, then Sarkari will come in.
So are we looking at a possibility of a lockdown, probably, maybe?
We are not praying for one. We are not praying for one, but if situations go bad, I think that might be a decision. I'm not the decision maker, but I think that might be a decision to be made by the top organs of the country, and it might happen if we don't do things that are supposed to be done. Yeah. So that's why let's keep. The media has also done an excellent job. Let me tell you. I was going to tell you all the things that we have succeeded in. Media has, the way it has portrayed these things for the last 2 months, has sent them a clear message to Kenyans. That's why they know. If you ask any Kenyan, they know what's Corona and how you're protecting yourself. They know. Everybody knows. But they're not implementing. And media has played a very, very crucial role in this. And I also want to thank the media. All the media houses, newspaper, print, TV, everybody has done a good job.
And we receive that very well. Yeah.
Thank you.
On
So
behalf of
you should continue doing that, because we are all working together. As I said, we all have a common enemy, and it's a good thing that there is cooperation and there is nothing going against each other. So let's work together, and it is doable. It's the next 3 weeks which are very crucial. If we can control this in the next 3 weeks, I think we are safe. Because if the curve starts picking up, it's going to be a dangerous sign. It's a very dangerous sign.
It's sort of out of speculation. In case we go the direction of a lockdown, we are not like other countries. Look at our situation and our circumstances. Like what I shared with you earlier, there are people who they live just for now. I don't know what will happen in the next hour. Telling this person to stay at home for 2 or 3 weeks, somebody who depends on just odd jobs, going to work every morning to earn some money for that day. What measures are being done to make sure that these people are also brought on board and they are taken care of during that particular time? What would be done?
Well, I'm not talking of a lockdown now, because I'm not praying for one.
Okay.
And let's not also wish about it, because sometimes even if you talk of lockdown, it might happen. So let's forget the lockdown. Let's think of how...
power in the spoken word.
So let's think of how Kenyans will start washing hands and keep social distancing, avoid going out, lock yourself in and do work from home. That's the first step. Okay. Now, if you are saying that there is a lockdown, tell me now, do you want to see a lockdown or do you want to see body bags in hundreds and thousands? You know, our situation will be worse than Europe, than Italy.
Why do you say that?
Because of our health infrastructure. It's not as good as Europe. Our food system, people are not rich, there is poverty. We have a lot of slums which they don't have in Europe. So these are all factors that will compound, and there will be more deaths. So is it better to lock down or to have those hundreds or thousands of deaths? We'll have to choose at that time. Yeah? So I think, as I'm saying, the only answer is prevention for us in Africa. We just have to prevent it and make sure it doesn't hit us.
All right. I want to ask you how you assess the general progress of the team that is headed by the Health CS Mutahi Kagwe, the National Response Team on COVID-19. How does it work, especially in terms of bringing on board all health stakeholders? What are some of the things how does it work, you know, that network, to ensure that everything that they plan, every decision that they make has brought everyone on board?
Okay. First of all, let me tell you, there is this group of health workers, most of the health workers, I would say all, they know what the enemy is. See, they're educated. They know what is coronavirus. They know the impact. So they're all united. All of us, people in the health, whether it's from national government or another county, we are all talking the same language. Even all the counties, we all talk to each other. You know, like Kilifi had one, so I'm talking to the Kilifi people. What are you doing? What did you do? How did you do? How did you manage? How is the patient doing now?
And the Kilifi case was unfortunate.
Yes, it was unfortunate. Yeah. So I don't want to discuss it. It's beyond my scope. But you see, we know there is an enemy, and we have understood what the enemy is, health workers. And I also want to commend the health workers. The work they are doing now, they are heroes of this country. Starting from the CS downwards, even the smallest worker, I'm telling you, all of them are working so well. My team, even the team from national government, from other county governments, they are doing a fantastic job. But the problem is the common person. He's not listening. You saw what was happening in Eldoret. The OCS or the OCPD had to come out of the car and scream and shout. I mean, We should not be doing that.
And people still traveling?
Yeah, they're still traveling.
Yeah, and
even when you go, you see in the matatu, there is a rule, but you see people sitting next to each other. I mean, they don't know the impact of one infection is equivalent to 1,000. Because, you know, one person touches 10 people, say around him, his family, friends, or whatever. Those 10 will multiply by another 10. Like that. You know, the infection keeps
rising by the hour.
It's logarithmic. You know, it goes very high.
Talking of which,
very fast.
Somebody asked me this before I came to the program. It's just a conversation about coronavirus, and there was that question of, you know, do you get infected in case, for example, somebody has just been infected a few minutes ago? Can they then infect another person, or does it take 14 days for them to be able to infect another person? There was that instant dialogue.
A virus is instant.
So if you've just gotten it, you can easily pass it to somebody else.
Straight away, yeah. And you'll not even know until 14 days, depending. Some people will know in 5 days, depending on your immune system. But 14 days is the maximum. But if I have it now and I can pass it to you straight away through droplets or touching, depending on whether...
Or on contaminated surfaces.
Yes.
But then...
That's how dangerous it is.
Yeah, because now you don't know, and it has to take 14 days for even the physical signs to be seen. And some do not even show signs. Why is this so?
Yes. That's why I'm saying that it is a silent killer, and the best thing is prevention. Prevention, social distancing, hand washing. That's the magic. And it's so easy. It's so easy. Kenyans can do hard things. This is so simple. Why can't we do it? You know, if you tell Kenyan we have blocked this road, they'll go around.
And still go where
you go. But now this is so straight. Go and wash your hands. Okay, there are a few who are doing it. I'm not saying everybody is like that. But all of us, we should all be in tandem. I should tell my neighbor, do it. In fact, in my house, anybody coming in, even myself, if I go home 5 times a day, I wash my hands.
Every time you get
Every time I get. I have a hand sanitizer in my car. Immediately I go from here, I'll sanitize. If I come down, I'm going into somebody's office, I'll do the same. In my office, I'll do the same. It should be a habit now for everyone. All right. It should be a habit.
So when you talk about, you know, the spread of this virus, we've had this term, self-quarantine for so long, especially those who are coming into the country and the suspected cases as well. And the question that has been raised is that who then follows up to ensure that this is, you know, implemented, and what does this term self-quarantine mean for somebody to understand that in case I have to go under self-quarantine, what is it that I'm supposed to do? What does this whole self-quarantine thing mean?
Okay, self-quarantine was 3 days ago. It stopped. Now it's mandatory quarantine. Anybody coming in now is put in a bus and taken to a hotel for 14 days at their own cost. So, you see, the government came in because we had these challenges of people not self-quarantine. So government said, no, okay, we'll do mandatory quarantine now. So you can see 2 days, we are filling up buses and taking all these passengers to hotels for 14 days. Why? Because of what you just said, people are not doing self-quarantine. They are supposed to be at home. When you say self-quarantine, it's not a jail that you lock yourself when you're alone.
So how do you do it? What is the recommended way of doing it?
Okay, recommended way, yes. You go into a room, you should be alone, number one, in that room. There should not be another person sleeping in that room. And this controls social distancing, hand washing for 14 days. And yes, you go into a room, you should be alone, number one, in that room. There should not be another person sleeping in that room. And this controls social distancing, hand washing for 14 days. And all your other household members, so if you have a wife or children, even with them, there should be social distancing. Because you might be one person who might finish that whole family. Ignorantly, you don't know, and you start, you know, as I told you, Kenyans are social people. They might start hugging their child.
Especially when somebody has been out of the country and they're back, there's that excitement to hug and to, you know.
But, you know, it's an indirect, he's an indirect killer of his own people, you know. So that is why we are saying self-quarantine, isolate yourself for those 14 days. Then you're okay.
What if circumstances do not provide for that? Probably the house is not that spacious to have just one room dedicated to self-quarantine for one family member for 14 good days. Yes. Are there other provisions probably that are there?
The government has no provisions. At least the Nairobi County government have no such provisions. But it is your life and your family. So you should find a way. It's like if I tell you now there is fire here, you'll find a way of exiting. All right? Even if there is no door, you'll jump from the window. So the same way, this is more than a fire. Corona is more than a fire. Find a way. I'm sure you'll find a way. Human beings are intelligent people. They'll find a way. Because he's not saving himself, he's saving his entire family. And you know, if he's infecting those 3-4, those 3-4 are doing 30 more. Because they'll be going out. You're self-quarantined, but your child is going out to play with other children. So you're actually passing it on to neighbors.
But talking about the burden of cost, though, just to cushion some of these people, especially them that are coming from other countries, and countries that probably for some time they have not been working, for some time they have not been earning anything, all they've managed to secure is a trip back home. And then they get here, the first thing you tell them is to go to book a hotel somewhere and stay there for 14 days at their own cost. Is there anything that is being done to that effect, just to cushion them?
But I think we have finished that. Today is the last flight, and that's the end of it. So it's just this 2-3 days.
Midnight today.
Yeah, midnight today, and it's over. So it's not a long term. So flights have stopped. It's only cargo flights which will come.
Yeah.
So I think this matter is sort of resolved. The few problems we will have, I think the national government is handling them on how to assist them or what will happen to them. I don't know because I haven't asked them. But it is a short term, and it is not. We are not doing it because we like it. They are doing it because it is good for you, the passenger, and your family. That's why this thing is done. Yeah.
Okay. There was also that issue of people taking advantage, especially some business people taking advantage of this opportunity to sell counterfeit products, especially when it comes to hand sanitizers.
Yes.
And it's good that we have you, because we want you to explain to us what are some of the recommendations. When I go purchasing these recommended products that I should be using at this particular time, what factors do I need to consider?
Number one, you see, you should get a brand which is known when you're going to buy. You see, the recommendation by even WHO is a soap. But you see, you cannot be having a soap on the streets. So that's why we use a sanitizer. Where possible, use soap. Yesterday
It's preferred?
Preferred, yes.
Okay.
Because it is more effective than hand sanitizer. Then hand sanitizer, you know, is alcohol-based. There are some cases, not in Kenya, outside, where the hand got fire, you know, because when you go to a naked flame. We are not going towards that side, but let's say when you're going home, you have a sanitizer and you have a soap. Soap is preferred. Where there is no soap, you use a sanitizer. So preference, that's why we are putting washing stations in Nairobi. We are not putting sanitizers, we are putting soap and water. If you go around now in the estates, you'll see those water tanks with a tap and somebody manning it with a soap.
I've seen quite a number.
Yeah, and also some corporates have come up. Thank you very much, I must say. And I'm even appealing to more corporates to come. If they can come to us, we'll give them the permission, they even man it. It should be free of charge, nobody should be charged. That is a condition. So when you're going to buy a soap or a sanitizer, number one is go for the good brands, which are known. You know, there are some new things which have come up.
Especially now. You'd
the
see
last
them
2 weeks.
Even hawkers are selling hand sanitizers.
Yes.
You're
Avoid
wondering,
that.
okay.
Go to a recommended shop. I would suggest pharmacies, because pharmacists are already trained professionals. They know what they're stocking. So I would recommend they go to a pharmacy. It will be much safer than a supermarket, because supermarket is not a pharmaceutical or science trained. Pharmacists are trained. They know what is right, what is wrong. So pharmacy should be their number one preference, because they know what they're stocking, and they will even get good advice from a pharmacist, because he's focused. Supermarket, you'll get 10,000 items. There's unga, there's sugar, the sanitizer is not their focus, or soap. Their focus is everything. They want to just, while a healthcare professional like a pharmacist, that is his job. That is the oath he took when he was graduating.
So they specialize on that.
He's going to preserve human life. Okay. So when he's giving you something, his conscience is biting him. Am I giving him the right thing? Am I giving him something that will go and work? So even before he purchases, he'll think that. So even when you see his stock there, they're also quacks. So, but that's another story.
In that industry.
You know in your estate who is a quack, who is not. So go to a good pharmacy which is a registered license. Now it's very easy to know. There is a reference number. You confirm with the Pharmacy and Poisons Board. That's the first place you should go and buy your sanitizer or soap. If you can't get it there, then walk to a supermarket. That's too also to your regular one, and get a brand which is known, not these new ones which have come up. I don't recommend that because I don't know. Some are even putting fake KEB stickers. Even the ones on the street, some have fake stickers.
So even the KEB sticker is not an assurance?
Yes, it is. No, it is an assurance, but the ones which are fake is not an assurance. So,
all right.
So that's why when you go to a pharmacy, at least there is some sort of security. In fact, a lot of security that you are getting the right stuff. Then not only you are getting the stuff, the right sanitizer, even you're getting guidance. If you need any information, all these pharmacists and farm techs or nurses or any health professional is now fully trained on coronavirus. So even if you go and you say, oh, I want to buy this, can you tell me how I can prevent my... All that I'm telling you, even that person knows. So there is also that education which he'll give to him.
Apart from just selling the product.
Yes, and not only him, even to his family. And there are some which who I've been talking to, some pharmacies, especially in the suburbs, they're even visiting the homes to tell them exactly what to do in the house. You see, they're not being paid for that. This is another good thing our pharmacists and pharmaceutical technologists are doing. They're actually visiting homes in those estates and telling them, okay, this is how you sit, but this now from today do this, live this much stress. When you're eating, do ABCD. There are people doing that at no cost because those are their future customers and they've been living with them all that time. So they've gone to that extent. Okay, that's why I'm telling you the health professionals are fighting the war together. Let us all do it together.
Let us also join the caravan, yeah?
Yes.
And walk towards that direction. Tell us the recommended percentage of alcohol. Yes, we see sanitizers on the shelf, but the contents are different from one sanitizer to the other, and the price is also different.
Yes.
So what is the recommended percentage of the alcohol that should be in this alcohol-based sanitizer?
It's 70% minimum, but you know, when you talk of fake, we don't know what is inside. We don't know. Because today I was reading in the paper, somebody is using spirit.
Yeah, I was about to ask you, the homemade sanitizers,
Yes.
is there something like that?
Yeah, they're using spirit. So
Is it a good, is it recommended?
No.
Oh my, like if there was something to do with, you know, you can take a spirit and Dettol and then you make your own homemade hand sanitizer.
Okay,
Can
that is
work?
the home one is short term. It works, yes, but it's not as effective as the alcohol based. But when you have nothing, say you are in the remote place and you have nothing, at least that is useful. And yesterday when we had this visitor with Mutai Kagwe, she even said we can use ash. You know, ash.
The normal ash?
Yeah, the normal ash. If there is nothing, it's not as effective, but at least it's better than nothing. Okay?
So spirit is
very dangerous.
Why?
It's very flammable.
It kills germs.
Yeah, it kills germs. It's very flammable and it's very sensitive on the skin. That's why it's alcohol based, which is recommended, not spirit. And all these fake ones, I'm sure, because spirit is cheaper than alcohol and it's readily available, I'm sure that is what they might be using it. I don't know, haven't confirmed, but I'm assuming because it's available and it's cheap. And it's something you can even just mix at home and people just label. So first recommendation, go to a non-pharmacy where you have been buying your medicine, go there and buy your stuff. If you don't get it there, go to a shop or a supermarket, which you know. Don't go to a new place. Go to places where you know. So if there's a problem, you can go back and say, you gave me this fake thing. But now, I even saw yesterday, cabs has started going around. So it will reduce. But, you know,
there's a crackdown on
there is a crackdown,
fake
but, you know, they're also overwhelmed.
products.
They're also overwhelmed. So it is us, again, to know what we are doing. So just buy a non-brand, go to a pharmacy, and besides buying, also seek advice. They'll give you a lot of advice. They have a lot of information on this virus and on prevention. All of them are having all this information. So it's just next door. So you walk out of your house, whichever is the nearest one where you have been buying your medicines. They are already trained, so they'll even give you advice. And even if you have any doubt, you can go back and ask him, oh, I forgot to ask you this, what do I do here? They'll give you advice. So instead of going, if you are staying in Huruma, coming to town to buy a sanitizer, why don't you buy it from the pharmacy next door in Huruma or in Dandora or wherever?
That is if it is legit.
Yes. No, that's why I'm saying pharmacy, most probably it's legit. I'm not saying that everybody is a saint in the pharmacy, but at least, you know, they are conscious, they are trained in health, and this is one of the oaths they take when they graduate, that they have to preserve human life. And let me tell you, most of them are good people. They will not do what we are thinking. And the few I'm visiting when I go, like when we go fumigation, I see they stock legit stuff, and they also give good advice. Like the one I told you who went to somebody's house. I really admire that person. He went all the way to his house to guide them.
All right.
Yeah.
So I want us to do a bit of a practical. You brought with you some...
Yes, but the
Just a
best would be a
demonstration.
soap, but we can still do it with a sanitizer.
Because you don't have water here.
Yeah, we can use this.
Yeah. So this is one of the, it's one of the products. So there are people who don't know how to use it.
Yes.
They have the hand sanitizer, but they don't know the best way to use it. So it could be counterproductive. So I want you to show, our viewer on the best way to use a hand sanitizer. That is the recommended hand sanitizer.
Yes.
What is the amount that you put on your hand, and how do you, go about rubbing and to make sure that it's effective?
Okay. Most of the hand sanitizers come with a pump. So it's already, the amounts are already graduated, automatic, So we'll assume everybody is using that kind of sanitizer where they are pumping. So it's either 1 or 2 maximum. Okay. If your hand size is bigger, you use 2. Children 1.
Okay.
But there are also some people with small hands, so 1 should be enough. The idea is to get 100% disinfection. Okay. Before even I start, it should be from here to here. Ensure the whole hand is disinfected. Okay. So there are many ways of doing it, but I'll show you the standard way, which is recommended by WHO.
All right.
And a lot of sensitization is ongoing all over the country. Although I want to talk of Nairobi, but it's all over the country. They're showing people the right way of washing your hands. Okay. So I'm going to show you that way. Although it's so common now, everybody is doing it. So you start there, then you do that. You do that.
In between the fingers.
Yeah, in
as
between
well?
the fingers,
Okay.
then the thumb. So you repeat on both sides. Okay. Then you do that because that.
Okay.
You do that.
The
again.
nails.
The nails, yeah. Like that. Because you don't know what's inside. That way. Again, you finish it off like that. It's simple. It takes around 15 seconds once you're getting used to it. And I can do it in 10 seconds now. Okay,
Because now
the time gets shorter and shorter. The first time it may take 30 seconds, 25, 20. You get used to. There are so many posters online. There are so many posters the government is giving. Some companies have started giving. Put it in your house, put it in your workplace, and just follow it once or twice. It's so easy. It's very easy. Do it the correct way.
All right.
You see, sometimes you'll even go and spend so much money on a sanitizer.
That's why I said.
Then you use the wrong way of doing
That's
it.
why I asked you that question, because there are people who have it, yes, but they don't use it the right way, so they end up not helping themselves.
There are
It's
two steps
counterproductive
which
just
I see
having
many
it, yeah.
people not doing it, and which I want to emphasize on, is this one. They
Yeah,
don't do,
yeah.
yeah?
The
Even you were
nails.
surprised.
Yeah,
this
I
way.
was surprised that
Okay,
you
and
know,
the other one is
actually
just
that
thumb,
one.
you know?
I knew about
You see?
the fingers,
Yeah.
that in between
Yes.
your fingers you have to focus
and
on
the,
as
and
well.
the thumb.
But I didn't know about the nails.
Yeah, so this you've learned something new?
Yeah, yeah.
So this
We
is,
learn
this
every
is,
day.
But the soap, this
Yeah,
is, the
sure.
best is soap. I still insist soap. So this is what you do.
Even when
And-
you're using soap,
Yes.
it is the same
Yes.
procedure.
And you all know good soaps. I mean, there are not, medicated soaps also available, but you know whatever soap you are using, a good
Every day.
But the soap, this
Yeah,
is the
sure.
best is soap. I still insist soap. So this is what you do.
Even when you're using soap,
Yes.
it is the same
Yes.
procedure.
And you all know good soaps. I mean, there are not, medicated soaps also available, but you know whatever soap you are using, a good brand. I don't want to mention the names, but whatever you're using at home now, it's the same soap. You don't have to go to get a new type of soap. There are new medicated soaps also you can buy now, but any soap, any good bar soap which you have been using all your life, same soap, just use it. So these are the two additional steps which people need to do. And you see the thumb. Most people don't also. But the thumb.
The
better.
thumb and the nails.
Yeah, yeah.
So
Okay,
focus
besides
on,
the others,
on the surfaces, focus on the
Yes.
surfaces, in
From-
between your
yes.
your
Because
fingers,
this is the first contact
the
you
nails
make.
and the thumb.
Yes.
About 10 to 15 seconds, depending on how you fast
Yeah,
you
you
do
see,
it.
the first
but
time you
yeah.
do it, the first time if you do it correctly, and you can download the poster from the net. There are posters in all government offices now. If you go, they'll even give you free. All the health facilities also, there are posters. Some companies are also given. The big multinationals I saw yesterday distributing. So just, it's free. Go and put one at your home. Call your family. They do a demonstration. The first time, the longest it will take you is 30 seconds. The longest. You do it, repeat it, 25 seconds. on an average, then after when you are a champion, 15 seconds.
You get used to
In
it.
15 seconds, you have saved your life.
How frequent should you do it though, throughout the
As
day?
frequent,
Like,
yeah.
after you do what specifically? So just
After
to be
anything
cautious.
you do. Even now when I'm finishing this interview, I
sanitize.
should sanitize. As often as possible.
Okay.
Till we have destroyed the enemy.
All right. The enemy is COVID-19,
Yes.
coronavirus, that has since claimed over, I think the number should be somewhere around 17,000, I'm not sure, but it keeps rising. But as at yesterday, the numbers were at about 14,000. So it is something that is, if you don't take care, is a killer disease. So take care, take precaution, do what you can, do as much as possible. I'll be asking Waziri more questions when we come back from this particular break. Do stay with us. And remember, your question can also get answered on this conversation. So remember to engage us on social media at KBC Channel 1. The hashtag is NewsCheck. And we are also asking you, are you content with the directives that the government has issued when it comes to managing the spread of coronavirus? We'll be back with much more right after this break. Stay with us. Welcome back to the program, and thank you so much for staying with us as we talk about coronavirus, the basics, the facts, what you need to understand, and also to understand what the government has done, even as we continue to report more cases of coronavirus in our country. And of course, even in Nairobi, if you're a resident, then I have your health CEC with me in studio just to talk about what they're doing as well in Nairobi County to ensure that they avert the spread of coronavirus. And that is what we want to take a notch higher. Waziri, I want you to tell Kenyans at large and Nairobi residents, to be specific, you know, about achievements that you've had. I'm seeing quite a number of things that you've been able to do. You talked to us earlier about establishing water sports within the CBD, just to ensure that, you know, people have access to water. But then talk to us about, you know, more that you've been able to do in terms of, you know, moving forward to avert the spread of coronavirus.
Okay, I think also you saw we have been visiting the markets where we are fumigating. Yesterday we did City Market.
Yeah.
Today we are doing Uhuru, Mudurwa. So all the markets, because that is where a lot of people go. So we are fumigating all those markets. We give them 2 days notice because, you know, they have their stuff there, and nobody should be there when we are doing the fumigation because we don't also them to inhale. So
do they take away their goods, the ones they sell?
most of them cover.
For example,
you know,
vegetables?
Yeah, no, vegetables are taken away.
Yeah.
But if the other stuff, you know, in the market you find so many
So
things.
many things, yeah, true.
So they just cover it with old gunia or whatever, canvas or something, which is also fine, provided it's covered. Then the entire place is fumigated. We have motorized fumigators, so it's very fast. So the
market is not closed for the entire day?
No, it's closed because you can't use the market that day.
For the entire day?
Yes, yes,
okay,
yes.
Okay.
It's for the chemical to be effective, you have to let it settle. So, like yesterday when we did City Market, in 2 hours we had 4 machines from all the 4 corners. We went and we did the whole thing. 2 hours it finished. So today is when they're going to now start using the place. And not entire place. Where there is food, it will be tomorrow. But the other places where they're selling curios and cosmetic, that one they'll open, there's no problem. Yeah. So that is one of the things. Then we went to all the high volume stages, you know, like railway, tea room, Cancom. We also we assisted the matatus in the fumigation and trained them how to fumigate, how to sanitize themselves, their passengers. Okay. Then we have a team. We have various teams which are also in high volume areas doing random checking of temperature and other symptoms. So if your temperature is high, it doesn't mean that you are a corona patient. So you are kept aside. Then you are interviewed.
Okay.
If you have a breathing problem, are you coughing, any other complication.
By high you mean which is the point where you need to be concerned?
38
Above
degrees
38.
centigrade.
Okay.
Yeah. So we in the last 3 days we got about 3-4 such guys, but it was a normal fever. So you see, it doesn't mean that if you have fever, you have corona. So,
or if you cough.
Yeah, if you cough.
Let me tell you something that people fear doing right now: sneezing or coughing. Even the genuine sneezing or coughing, you just feel like you're guilty.
Yes.
And people look at you like
it has become
you're
antisocial.
Yeah.
Coughing and sneezing has become antisocial. But you can't control it. I mean, if it's a normal cough and sneezing, it's okay. You know, sometimes it's an allergy. You know, if you smell something, you sneeze. That's fine. It doesn't mean that you're infected. So this is one thing we are doing even now ongoing, is this randomly. We are going to places where there is high volume, like Ikomba Market, Tea Room, all these areas I mentioned. Dagoretti side also, we have our people there. So what they're doing is doing temperature. If we find high temperature, the person is put on the side, and it's done randomly. We don't do everybody. We can't do 7 million people. So it's just random. Somebody is called, temperature is done. If it's high, we put him on the side. Then we tell him why we put him on the side. If he's okay, we release him, tell him go to a doctor, because if you have high temperature, maybe you have an infection somewhere. So we have a good thing is we have not got a single patient in that monitoring who has been taken to hospital. So that's one good thing. Yesterday, the Nairobi County government waived all the fees for mortuary for 7 days. So if anybody has his loved one who passed on and is lying at any of our mortuaries, we have waived fees in totality. Just
for all mortuaries within Nairobi County?
All mortuaries owned by the county, not all mortuaries.
Okay.
Yeah? The government, Nairobi County government mortuaries.
Right. Okay.
So we have the main one is the city mortuary, and then we have mortuaries in 1 or 2 hospitals. So if you collect your body before 31st March, close of business, you will not be charged anything. So I have also appealed to anybody who has their loved one there, kindly take advantage of this waiver and take your loved one and bury them as soon as possible.
Why is this necessary? We saw this, we have seen this being implemented in several counties.
Yes.
There are other counties that say, you know, if you bury your relative or your kin immediately, if you can, or within 24 hours.
Yes.
Why is this necessary?
I'll tell you. Number one, who takes bodies to mortuaries, a city mortuary or county mortuaries? They are poor people. The rich men will take them to the known places where they pay millions to store their body. It's a poor man who has a problem. So when he's taken to city mortuary, there is a bill they have to pay.
The fee is waived, and they're allowed to pick up their bodies. You can talk more about that.
Yes,
and I was interested on the percentage. Is it full or is it up to a certain limit?
Okay, let me first correct you. It is not a drastic move. We are calling it a strategic move.
Okay.
Okay, so it's a strategic move in the sense that we will decongest our facilities. Also, it will benefit the family that they are not paying anything. The people, like I said before, the people who bring bodies at mortuary are generally the people who are poor. So this is also an opportunity for them. 7 days from yesterday, 31st of March, close of business, 100% waiver. There is nothing you are paying. Just go and collect your body. You see, there is a procedure of collecting body. It should be given to the right person. So if you are the authorized person to collect, go and collect.
So by the 31st of March,
close of business,
you ought to have collected your body.
Yeah, then there is no charge. 100% free.
It's free.
Absolutely free.
This is in a bid to decongest.
Decongest, and also you see the other reason is, you know, when they are doing a harambe, again they are meeting. So those harambes will stop for collecting money. Yeah, you see.
All right.
And these people are in the slums. You know, already they are having challenges, and then they do a harambe. Okay. So we want to stop that. So they collect their bodies and proceed.
So what about people who may not be in a position to do that by the deadline that is the 31st of March for one reason or the other?
Okay,
what will happen?
I'm assuming, and I'm still
appealing. Is it mandatory or it's voluntary?
Well, it is not mandatory because it is not an executive order. Yeah. But since it is free, why don't they just pick and do the burial? And we have given them 7 days. Normally other counties gave them 2 days and 3 days. We have given them 7 days because I know Nairobi is a challenge. Most people want to take their loved one up country to bury or to do the final rites. So we gave them 7 days. In 7 days they will arrange, because most of them will do it. Although I think weekend will be busy for us. And we may, if we see on Friday that we are busy, we may open on Saturday for them also to collect, so that we give them the maximum. Yeah, when we say 7 days, it also included Saturday and Sunday. Okay. So we'll try and work on Saturday if there is that demand for them to collect, and it's 100% waiver. It's free. Absolutely free.
So what happens after that, in case
after that
will not have been collected?
Yes, if they are uncollected bodies, you know, there are also bodies which we store there which have court cases. Those are exhibits you cannot touch, so those will not be touched. But there are some who just dump bodies and go away. We have bodies there staying for very long. So there is a legal process where we have to gazette and go to court. That's the process we are going to start after the 7 days, and we sort of dispose those bodies. Of course, they are done in the correct way. So that process will start on 1st of April. So those who have not claimed, or those which are not claimed, you know, there might be some which we know that, okay, this Mr. So-and-so is a claimant, he'll be contacted, and then a notice is given to him that collect your body within 7 days. But that time, on 1st of April, he's paying. That's why we are giving them this window, come and pick it without paying. Okay. Because most of them say, hakuna pesa. Now, you don't need money, come and collect.
Yeah. So it's going to come as a relief
yes,
to
it
most
is.
of
It is
these
just another additional way of controlling the virus, in the sense that we are avoiding those harambes. You know, that's the whole idea, to avoid the harambes. And you know, now also burials are not supposed to be many people.
Yeah,
they are limited. So do it at this time.
And we hope that, you know, that this will go a long way in helping in that situation, and probably, especially at this particular time that finances seems to be tight.
Yes, that's the objective.
Yeah.
That is exactly the objective.
Let's talk about, in case I am in Nairobi, and yes, I want to play my part in combating the spread of COVID-19, and in my neighborhood or in my community, we have a suspected case, or somebody just you know, showing those signs that are associated with COVID-19. Within Nairobi County, what are the steps that have been put in place to ensure that every person from every residential area is catered for, any suspected case is catered for and handled carefully? Okay,
the first thing is, when somebody coughs or sneezes or has high fever, do not panic.
It doesn't mean they have
COVID-19. Okay, so that's number one. This thing, don't panic. Even if somebody has it, don't panic. You know, panic is itself a big problem. So don't panic. The first thing you do is isolate that person. If it's in a house, isolate him. If it's in a church or wherever it is, isolate that person. Dial 719, and the other numbers which are already in all the medias. Those are the numbers you dial. Red Cross is also our partner, AMREF. There are so many other partners, but we have 100 facilities all over Nairobi owned by the county. So they can go there. There are some facilities which close at 6. So after 6, if you get a suspect like that, call that number. Or call Red Cross, AMREF. There are many other partners who are willing to assist us. We have our own ambulance services. So they will pick that patient, and we are taking them to Mbagathi and Kenyatta, depending on that time which doctor is available where. So health facilities only have an isolation, a place to isolate. Yes, but no treatment. Yeah, no treatment is done only at Kenyatta and Mbagathi. Yeah. Which brings me to the question, is it a killer disease like some people have really baptized it to be? If ignored, yes. If ignored. That's why education and sensitization is important. Okay, and the spread, we have to disconnect that cycle. You know, we have to disturb that cycle. That is why you see lockdowns in other countries. Yeah, so the only solution is to break that vicious cycle, and we are okay. Okay, otherwise, if it is controlled well, it is not so deadly. It is controllable. We have seen so many stories of people who survived all over the world. So it is how you handle it. But don't panic. I read somewhere that when they saw this kind of operation, the whole estate moved out. I mean, as if it's because of lack of information and panic. No, it's panic. It's not they know. See, even where we are sitting, but even if you had it or I had it. I think it's a killer disease. That once you have it, everyone around you will get it, and you will all die. But you see, even if you had it or I had it, the distance we are now, it's okay. Even if I have it or you have it. See, that's why they call it social distancing. Okay, that's enough. Call the doctor, call the numbers which we have now, the hotlines, and somebody will come and collect that patient, and we take it. It does not mean that he has it. When he goes there, the test will confirm. If it's positive, then only he'll be admitted. Otherwise, he'll be told go back home. All right. Maybe it's just an ordinary fever or an infection. The medicines will be given, and he'll be returned to where he was collected. So what do you know about the progress that has been made in treatment and the care of the cases that have been confirmed to be positive so far? Well, there are many people coming up with different types of stories. But these are all stories, these are all hopes. Immediately there will be a treatment, it will be hot news, breaking news all over the world. The Americans are working, the Indians are working, the Chinese are working. In UK also the Institute of Tropical Diseases, they're also working on a vaccine. Israel is doing it. So immediately it's done. It's going to be like when we got chloroquine for malaria.
Yeah.
So whenever we get anything for corona, it will be big
So
news.
far,
there is
no
nothing
confirmed
at the moment as we talk.
medicine.
Yes, but FDA is the US FDA is also testing some 1 or 2 combinations. So immediately it comes, we will know. All of us will know.
So how are our patients in Kenya faring, from what you know?
I can't comment on that. That is a private whatever. We don't identify them. We don't want to tell you anything. So let them come out and tell you the story.
Okay.
We don't.
I see
But
what
there is
you've
one
done
more.
there.
There is one more appeal I want to make through your station. You know, we have recalled all our health workers. If there is anybody still who has not reported, please come back. We need you now. So we recalled last week all health workers who were on leave. So if anybody has not reported, so I'm appealing all health workers in Nairobi County to go back to work. This is the time we need you.
All right. I also want to ask you, in terms of the measures that have been put in place to mitigate the spread, there was a lot of financial allocation, a huge budgetary allocation to that effect. How should this be implemented? How should this money be spent? Having been in part of the team that is really working round the clock, even right now, I know there's a lot that is, you're supposed to be attending to. What are the areas that you see and you think these are the areas we need to prioritize when we are allocating funds, when we are putting up efforts? These are the things that we need to consider from where you sit.
You know, when you say a lot of money, what was given is a drop in the ocean. That's not a lot compared to other countries.
All right.
What we were given in Kenya government by the treasury is actually a drop. That is not enough. But yes, to you, you'll find it's a lot of money. But you know, we are talking of 44 million people. 44 million. If you divide that money by 44 million, it's nothing. Okay. So, but you see, as Kenyans, we also adjust. We are good at adjusting our lives. So we'll adjust with that and do
What is there?
We'll maximize. We'll maximize. You know, we'll maximize. So even our health workers, you know, I mean, if you see, they are maximizing on their own time. Also the supplies they get. You know, before you would see somebody maybe they're using a glove or a mask anyhow. Now they use one mask the whole day. They use the second one the next day, unless they had a case. You know. So also the staff are trained that way, that avoid abuse. All right. So we are adjusting with that funding which we got. But we have been pleading, and we might get more. Let's pray.
So if you're given the chance to decide on how that money should be spent, what would be your priority areas? Knowing the challenges that we are facing currently in curbing the spread of this disease, what would be your priority areas?
The first priority is to safeguard the health workers, because they're the ones who are treating. They are the heroes today. People who are working in the hospitals today, they are risking their lives. They are the heroes of Kenya today, because you will not come to my house when you are infected. You'll go to hospital, and who is in the hospital? It's the doctor, the nurse, the pharmacist, or whoever is there, yeah. So we have to safeguard them. So we need to equip them with the right attire, those suits or whatever. Then medicine, disinfectants. The other big chunk which is going, which I would spend on, is education, educating the people, which we are doing, and you see the results are good, but now implementing is a challenge. So that is where we should focus.
All right. Yeah. The testing of coronavirus, right now what we have is just concentrated within Nairobi County. There has been concern from other parts of Kenya concerning now how do we cushion ourselves against the spread of this virus if we cannot even test these cases. What can you comment concerning that?
Okay, it is not true that it is only in Nairobi. Now corona is tested even in the counties. Not all counties, they are selected. And also Kemri, wherever there is Kemri, like we have one in Kilifi County, there is one in Nyanza. Wherever there is Kemri, there is a corona testing lab. Plus there are 1 or 2 other counties. And yesterday you saw there are some kits which Jack Ma donated.
Yeah, the
So
government
I,
received
so I
them.
think even that one will be distributed to various counties.
All right.
Especially the most vulnerable ones, you know, like the border areas around Uganda, Tanzania. That's a very critical area, Tanzania border. So I think those counties will be given priority.
So it's not all counties, but there are certain counties.
No,
there are some
everybody will
counties
get
that
a
have-
share, but they will
Okay.
get a more than what say Isiolo would get.
Okay.
Because they don't get too many visitors. It doesn't mean they don't get a visitor, okay, from outside. But the numbers will be less than say Busia, because it's at the border.
All right. Thank you so much, Waziri, for your time. I want you to give us your final remarks concerning, you know, what's the next step? What's the way forward? Earlier you said the next 3 weeks are going to be very crucial for this country. I want you to pick up from there and tell us, what is it that you project we should be doing? What do you project will be happening in the coming days?
We just pray that we can sustain, and where we are, we remain there. But I appeal to Kenyans: sanitize, wash your hands, social distancing. These 3, if we can all do in tandem. You see, I do it alone and you don't do it, the effect is less. But if all of us did it and we said, let's do it the way the Chinese did it, this thing will be history. We will have fought the enemy and we'll have won the war. You know, we are in a battleground now, so we have to come out victorious. Kenya has gone through a lot, and we have always come out, and I'm sure even this one we can. So let's all join hand and fight this one enemy. And I think it is possible. It is possible. We have fought so many things. Let's not go back and scratch old wounds, but we have gone through.